Question number 1. What is the most common cause of osteomyelitis? The correct option is C. Bacterial infection. Question number 2. Which test is used to assess carpal tunnel syndrome? The correct option is A. Phelan's test. Question number 3. Which fracture occurs due to the twisting force? The correct option is C. Spiral fracture. Question number 4. Carpal tunnel syndrome affects which nerve? The correct option is C. Median nerve. Question number 5. Which type of fracture is commonly seen in children? The correct option is B. Green stick. Question number 6. Which hormone helps in maintain bone density? The correct option is C. Estrogen. Question number 7. What is the primary complication of an open fracture? The correct option is B. Infection. Question number 8. What is the best position after total hip replacement? The correct option is D. Hip abduction. Question number 9. Which type of fracture is most common in osteoporosis? The correct option is C. Compression fracture. Question number 10. Which bone is most commonly affected in Colles fracture? The correct option is B. Radius. Question number 11. Which test is used to diagnose osteoporosis? The correct option is D. DEXA scan. Question number 12. The recommended daily calcium intake for adult is? The correct option is C. 1000 milligram. Question number 13. What is the most common site for a fracture in older adults? The correct option is B. Hip. Question number 14. Which traction is used for femoral fracture? The correct option is a Russell's traction. Question number 15. Which X-ray finding is characteristic of a stress fracture? The correct option is C. Hairline crack. Question number 16. Which hormone plays a major role in bone remodeling? The correct option is B. Calcitonin. Question number 17. The presence of Harbin's nodes is associated with? The correct option is C. Osteoarthritis. Question number 18. Which joint is most commonly affected in osteoarthritis? The correct option is B. Knee. Question number 20. Which device is used to immobilize a broken bone? The correct option is D. All of the above. Question number 21. Which material is most commonly used for modern orthopedic implants? The correct option is B. Titanium. Question number 22. What is the most common cause of lower back pain? The correct option is a disc herniation. Question number 23. Which electrolyte is most important for bone strength? The correct option is C. Calcium. Question number 24. What is the most common site for a hip fracture? The correct option is B. Femoral neck. Question number 25. The most common fracture in osteoporosis is? The correct option is C. Spine. Question number 26. Which restriction is used for femur fracture in children? The correct option is C. Variance traction. Question number 27. What is the initial treatment for a suspected fracture? The correct option is B. Immobilization. Question number 28. Which vitamin is essential for calcium absorption? The correct option is a vitamin D. Question number 29. Which diet is recommended for a patient with gout? The correct option is the low purine diet. Question number 30. Which fracture occurs due to repetitive stress? The correct option is C. Stress fracture. Question number 31. Which nerve is affected in carpal tunnel syndrome? The correct option is D. Median nerve. Question number 32. Which traction is commonly used for hip fractures before surgery? The correct option is A. Bucket's traction.